talk about probiotics today, it has become a household name. Everybody knows about probiotics. But actually, according to the WHO definition, a probiotic is a live microorganism which, when given in adequate quantities, confer health benefits. Probiotics are basically divided into various types, and there are many bacteria. Like primarily you have what you call lactobacillus group of bacteria, then you have bifidobacterium group of bacteria, and there are some yeast also have some benefits when given orally, like Saccharomyces boulardii. If you take this probiotic, now say for example, if you take lactobacillus, there are several species of lactobacilli, and the studies have shown that different lactobacilli has different effects. Like for example, lactobacillus has many types, and what we use, like the commonest one is called lactobacillus acidophilus, then you have lactobacillus rhamnosus, then you have lactobacillus reuteri, and so on and so forth. Now reuteri, for example, is lactobacillus reuteri is known to be very effective in the treatment of infantile colics in children specifically. And lactobacillus rhamnosus, for example, a lot of research has been done on antibiotic-induced diarrheas and diarrheas. So that does not mean the other lactobacilli are ineffective, but they are effective. But the studies that shown, I told you at the beginning that scientifically you have to prove that this is the best. Lactobacillus reuteri, there is a strain called DSM 17938. which is the one which works really for infantile colics, and more than that, there is a group of disorders called functional gastrointestinal disorders in children particularly, but you get that in adults too, like what you call functional abdominal pain in children, particularly school-going children tend to have this abdominal pain which is non-specific. But the important thing is there are group of disorders where you cannot find organically anything wrong with the child. All the tests that you do are going to be normal, but they comprise of on and off tummy aches or dyspepsias and so on and so forth. So those particular functional gastrointestinal disorders, the so-called reuteri, a group of bacteria, the lactobacillus reuteri, seems to work very well. The probiotics generally can be used in children with constipation, particularly in infants. Infants with constipation, they tend to have loose motions when you use probiotics together with prebiotics. And also, as I told you, reuteri specifically will work for infantile colics and functional abdominal pain in children. And also, nowadays there are a lot of ongoing things about mental health and pregnancy. So, our future, we can use probiotics as a tool for future health.